Hello, my beautiful Lady Gardens, and welcome back to High Tea with Lady B, the podcast where we spiral into the normal, but not so normal, the wild, the wonderful, and the sometimes totally effed up world of ladyhood, wellness, and the occasional what the F topics. And today, ladies, buckle up because it's one of those WTF topics. Peri-episode number 2. As my girlfriend would say, darling, I am here for a rant, and rant I shall. We are diving into something that's been hiding in plain sight, or should I say, hiding in your bloody medicine cabinet. This article landed in my inbox the other day from National Geographic and gave me a serious holy shit moment. We are talking about an over-the-counter drug that millions of us have taken, probably since childhood, and without a second thought. But new research is suggesting it may increase your risk of dementia. Yep, pour a coffee, actually ditch the coffee, line up the vodka shots, and let's unpack this together. We are talking about diphenhydramine. Try saying that after having a lip flip. It's the active ingredients and loads of antihistamine products. In Australia, you'll find these in Peter Children's decongestant antihistamine, Benadryl, cough and medicine for dry coughs, Benadryl Original, Snoozane, Unisom sleep gel, night pain relief pharmacist choice, Misonized, paracetamol diphenhydramine, Panadol Night, and chemist's own diphenhydramine. Now, this is just a few of the products that contains this. Diphenhydramine is a first-generation antihistamine originally designed for allergy relief. But here's the kicker. First-generation antihistamines block histamine receptors everywhere, including your brain and central nervous system. Second-generation ones like Zyrtex and Telfast, they leave your brain and central nervous system alone. Now, why does this matter? Because when diphenhydramine crosses the blood-brain barrier, it messes with a key neurotransmitter called acetylcholine, vital for memory, attention, and movement. In one clinical trial, just 50 milligrams, the usual dose is 25 to 50 milligrams up to 4 times a day, and this was 50 milligrams a day, caused participants to show reduced memory and focus compared to non-users. And get this, the effects are even worse with age because the drug stays in your body longer. Less acetylcholine equals less brain power over time, and that equals cognitive decline. Studies have been stacking up that long-term and high-dose use of diphenhydramine is linked to memory issues and possibly even dementia. And these effects can show up years after the drug has been stopped. One study that was published in 2015 in the JAMA Internal Medicine found that daily use for just 3 years increased dementia risk by 54%. Let me just repeat that. Daily use of dimethylhydrine for 3 years increased your chances of dementia by 54%. That's when compared to people who only took it occasionally for under 3 months. Essentially, this drug can permanently alter brain structure and neurotransmitter pathways, and we have been handing it out to our children. This is where it gets really sneaky. Because dimethylhydramine makes you drowsy, it's also been sold as a sleep aid and is used for insomnia, anxiety, cold and flu, motion sickness, nausea, and even Parkinson's symptoms. You could be unknowingly taking it with your allergy tablet, your nighttime painkiller, your sleep capsules, a cold and flu syrup, and your nausea medication. Suddenly, you're stacking doses without even knowing it. And yes, it is one of the most overused and abused medicines in the US, according to Dr. Samati Sinder, a pediatric allergist that has been raising the alarm. Even short-term high dose can cause toxicity. We're talking seizures, hallucinations, fast heart rate, confusion, urinary retention, and ataxia. Which, what the fuck is ataxia? It is basically loss of coordination. Think about losing the loss of your muscles and your coordination. But before you panic and tip your entire medication cabinet into the bin, this isn't about fear. It's about informed choices. Short-term use is generally okay. Long-term use daily, reconsider this. Safer alternatives do exist. Talk to a GP or pharmacist and check your labels and be on the lookout for diphenhydramine and anticholinergic. Examples of these first-generation antihistamines to watch out for will be in our show notes and on socials, because I freaking can't say them. It was such a tongue twister, taking me like 30 minutes to get them right, and I still didn't nail it. So what you want to do is try and consider swapping these out for second-generation options like Zyrtex, Telfast, or Claritine. I can say those, can't I? Now, at Pussy HQ, we're all about giving you the truth, no sugar-coated version. If you've been popping a pink pill to drift off at night, no shame. But maybe now's the time to check your stash, keep your brain and your memory and your future intact. Tonight, maybe try a calming tea, a magnesium-soaked, a steamy novel, and just take some progesterone, ladies. Gosh, that makes me sleep like a freaking baby. Actually, babies don't sleep. Fuck that. It actually just makes me sleep amazingly, like when I was in my 20s and 30s. If you can't sleep, come and hang with me, because there's nothing like a little high tea with Lady V to get your mind buzzing in a good way. Not sure if that's a good sleep alternative. I'll also pop some sleep alternatives in the show notes and the socials. I totally promise. If today's episode has made you stop and think, or laugh, or gasp, share it with friends, leave a cheeky review, and make sure you hit the subscribe button. This has been your reminder to read your labels, trust your gut, and to protect that brilliant mind of yours. I can't wait to bring you next week's episode, which is all about urinary symptoms and what we can do about it. Just don't pee yourself. Can't wait. Remember, water those lady gardens because they deserve it. And knowledge is power, power is wisdom, and a wise vagina is an informed vagina. Please note that this podcast is for entertainment purposes and informational purposes only. The content shared is not intended as medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider for any medical concerns or before making any health-related decisions. The views and opinions expressed on this podcast are those of the host and guests, and it does not represent those of any medical organisation or institution.